Right now, the Department of Health has been working with getting persons on board, so to speak, with vaccinations. Vaccinations have been a source of contention for a lot of people for a long time. I went to school in Alabama, so there's the Tuskegee experiments and all of these historical angst or wrongdoings I'm very familiar with. And as a psychologist, I'm even more familiar with how persons have been struggling to understand how important vaccinations are. What we've done is we do door-to-door. We have a boots on the ground team. We print information, we go door-to-door, we answer questions, give you information on there, and encourage that patient-physician relationship, which is essential. I think, since this has started, we've had a lot of people go to medical school, if you know what I mean, through social media, and so they have their own opinions, which is fine. But we're encouraging persons to go the right ways. The WHO networks, Department of Health, CDC, so you can get the information that you need to make informed decisions. So the Department of Health supports that. We put our information daily. We're very transparent with the numbers, having just over 19,000 persons vaccinated. We try to utilize who's been vaccinated to make a difference in the community. And so health has unified with a lot of people to try to just make it a more understandable experience, because vaccinations aren't new, but it's essential.
Afternoon and welcome to the Government House weekly press briefing and COVID-19 update for the week of March 8th, 2021. For the benefit of the radio listening audience, my name is Richard Mota, Government House Communications Director. Joining me today is Health Commissioner Justa Encarnacion, who will provide an update on the latest COVID-19 statistics, an update on pop-up testing sites, and an update on where we are with our COVID-19 vaccinations in the territory. Also joining me this afternoon is Senior Area Manager for the Small Business Administration, Mr. Wayne Huddleston, to provide an update on the Paycheck Protection Program for businesses in the territory impacted by COVID-19. But before we go to Commissioner Encarnacion, we have some good news for the public concerning our community vaccination centers. We are now 1 week into phase 3, or the public phase of our vaccination strategy. I am pleased to announce that we have taken an additional step to make it easier for Virgin Islanders wanting the vaccine to get it. Now Virgin Islanders 16 years or older wanting the vaccine can schedule and fill out the necessary documents and receive the vaccine at any one of our community vaccination centers online. You can do this by visiting the Department of Health's website at covid19usvi.com/vaccines and by clicking the book appointment button. I will repeat that. You can book your appointment book your appointment for the COVID-19 vaccine at covid19usvi.com/vaccines and by clicking the book appointment button. For those individuals who do not have ready access to the internet, you can still book your appointment via FITEMA's vaccination hotline by dialing 340-777-VAX or 340-777-8227. As a reminder to the public, our vaccination centers are located at the UVI Great Hall at the Albert A. Sheen campus for St. Croix residents and in the St. Thomas UVI Sports and Fitness Center for residents of St. Thomas, St. John, and Water Island. The centers are open Monday through Fridays from 8:30 to 3 p.m. Appointments are required, but there are instances where people do not show up for their appointments, and to ensure that we do not waste any vaccine doses, walk-ins will be accommodated based on the availability of vaccination doses. I am encouraged that now 1 week in, we have not had any wasted vaccine doses. We have accommodations on both islands for seniors and persons with disabilities. This includes parking and a short walk to the designated entry for them. We also have options for ASL interpreting and a special waiting area for you before and after you receive your vaccination. Commissioner Encarnacion.
Thank you, Director. Good afternoon, residents, Virgin Islanders, and everyone listening. As of March 6, 2021, the Department of Health has tested a total of 49,337 persons under investigation, or PUIs, of which 2,735 have been tested positive and 46,600 have tested negative. There are currently 136 active cases in the territory. 2,574 cases have recovered, with 25 fatalities related to COVID-19. A little breakdown of those active cases: St. Croix 85, St. Thomas 50, St. John 1. From our hospitals, Governor Wang F. Louis Hospital and Medical Center reports 3 COVID-19 cases with 1 vented, and the Schneider Regional Medical Center reports 0 COVID-19 cases. Wonderful news. Our surveillance efforts continue with our epidemiology hotline. Our hotline remains open 7 days a week from 8 a.m. to 10 p.m. For callers to report suspected cases of COVID-19, you can call both numbers, St. Croix or St. Thomas, 340-712-6299 or 340-776-1519. We're also hosting pop-up testing events this week. You can pre-register for pop-up testing online at COVID19USVI.com/testing. I'll repeat that, COVID19USVI.com/testing. Here are our upcoming events. St. Thomas at Home Depot, Tuesday, March 9th from 1 p.m. to 3 p.m. St. Thomas at the Lionel Roberts Stadium, Thursday, March 11th from 1 p.m. to 3 p.m. In St. Croix, at the Canagata Rec Center, Tuesday, March 9th from 10 a.m. to 1 p.m. St. Croix at the Bodo Park, Thursday, March 11th from 10:30 a.m. to 1:30 p.m. In St. John at the Vipa Gravel Yard, St. John at the Vipa Gravel Yard, Wednesday, March 10th from 1:30 p.m. to 4:30 p.m. All testing sites continue to report data to the Department of Health. We then report those numbers, into our epidemiology reports that you see daily. The past week has been very eventful. We successfully opened our community vaccination center, as Director Mota stated. In St. Croix, just a reminder, at the University of the Virgin Islands Great Hall from 8 a.m. is actually from 8 a.m. to 5 p.m. And at St. Thomas at the UVI Sports and Fitness Center from 8 a.m. to 5 p.m. We want to thank Dr. Hall for his assistance and his staff for your support of the CVCs, as we call them. As of March 7th, 16,926 first doses have been administered. 7,959 second doses have been administered. That's a total of 24,888 doses administered. Remember our goal, we want to reach 50,000 unique individuals for the first dose administered by July 1st. Hence, at the end of July, we would have inoculated a total of 50,000 individuals in its entirety. With everyone 16 and over eligible for the COVID-19 vaccines, there are no barriers to getting vaccinated. There are accommodations being made, as Director Mota indicated, for seniors and individuals with disability. If you or your loved ones need special assistance, I encourage you to schedule an appointment. You hear some repetition, and please bear with me, I will repeat, because it's important for you to be able to have access to the vaccines. Please call 340-777-8227. That is the VITEMA call-in number, or visit COVID19USVI.com/vaccines. As Director Mota indicated, there is a little box that indicates that you can actually book your vaccines. Please press that, and you can electronically set your own appointment for a vaccine. Upon arrival at the CVC, you will receive direction to park in a designated ADA parking lot if you need accommodations. For persons who are deaf, there is a virtual relay interpreter system in place for them to help you communicate. There is also a special location for you to sit and wait before and after your vaccination. If you have persons care attendant, personal care attendants needed, who is bringing you for the vaccine, they too can register at site and be vaccinated the same time that you're vaccinated. Getting COVID-19 vaccine is easy and the process is smooth. I want to remind you once again, once you get the COVID-19 vaccine, you should download the vSafe app. vSafe is a smartphone-based tool that uses text messaging and web surveys to provide personalized health check-ins after you receive a COVID-19 vaccine. Visit vsafe.cdc.gov/. Why? Because it allows us to pull data from you. It allows us to see whether or not you're actually receiving or you're feeling any symptoms from the COVID vaccines, and it later will allow us to look at that data and provide better access to care, provide information to the general public. The app in itself allows you to report any side effects that you may experience, and it can also remind you about your second dose. To keep up with the latest information, please visit the U.S. Virgin Islands Department of Health Facebook page on our website, www.covid19usvi.com, or for COVID-19 health information, text alerts COVID-19 USVI to 888-777. Let me repeat that. Text COVID-19 USVI to 888-777. And actually, Director Mota just received his vaccine last week, and I'd like him to tell you his experience, as well as to let you know if he has had any symptoms, and ask him if he signed up for vSafe.
Thank you, Commissioner. Yes, I did receive my vaccination, my first dose of the vaccine last week. No symptoms, no side effects. It was easy and seamless. And I must thank the Commissioner and everyone at the vaccination center for making that process as easy and seamless as possible. I have not signed up for vSafe, unfortunately, but I will do so as soon as the briefing ends this afternoon, because I understand how important that data collection is in terms of helping the CDC understand more about how the vaccinations are affecting individuals, and to also help other people get to make more better informed decisions about whether or not they should take the vaccination. So thank you, Commissioner.
Thank you.
With that said, I will turn over the briefing to Mr. Huddleston from the SBA.
All right, good afternoon, and thank you, Governor Bryan and Mr. Mata, for this opportunity to share important information regarding the U.S. Small Business Administration's economic aid programs available to assist Virgin Island business owners as we continue to cope with the economic burdens caused by COVID-19. I would like to highlight 3 programs today. The first is the Paycheck Protection Program, or PPP, a forgivable loan which keeps workers on payroll and connected to their benefits during this unprecedented time. If you're a small business owner with employees, a sole proprietor, or an independent contractor, you are eligible to apply through any PPP participating lender. Loan proceeds can be used for eligible payroll costs and non-payroll costs, including commercial rent, utilities, mortgage interest, and COVID-19 worker protection costs. The PPP has made a difference in the Virgin Islands. Since the program began last year, over 2,360 small businesses have been approved for over $158 million here in the Virgin Islands. This relief to hard-hit small businesses has allowed them to rehire and retain workers, safely reopen, and deliver the essential goods and services our community depends upon. Only 3 weeks remain before the PPP closes per the Economic Aid Act that passed Congress. To apply for a PPP loan, please contact your bank or preferred lender soon to begin your application. All of the 5 large lenders in the Virgin Islands, Popular, Oriental, First Bank, Merchants Bank, and Bank of St. Croix, are participating, in addition to thousands of SBA lenders across the country. You may also utilize the SBA PPP Lender Matching Tool or the Lender Match Tool on the SBA website to connect to PPP lenders. Do not delay in taking advantage of this program. It will expire. The second program I would like to highlight is the Economic Injury Disaster Loan, commonly referred to as EIDL. The EIDL program provides economic relief to businesses and nonprofits that are currently experiencing a temporary loss of revenue due to COVID-19. EIDL loans are long-term, low-interest loans with 3.75% interest rates for businesses and 2.75% interest rates for nonprofits. They may be paid back over 30 years with no prepayment penalty. As of February 16th, 1,783 Virgin Island businesses have received an EIDL loan totaling over $96 million. EIDL funds still remain for businesses and nonprofits who have not yet been approved. To apply, simply visit www.sba.gov to submit your application directly with SBA. Finally, I would like to highlight the technical support providers available to assist Virgin Island businesses right now. The Virgin Islands Small Business Development Center, operated in partnership with the University of Virgin Islands, is available to assist any business owner or entrepreneur. The highly trained staff at the SBDC can work with small business owners for free and help them compile the needed documentation to apply for these programs and assist with gathering needed paperwork. Moreover, they work one-on-one with entrepreneurs to help start, grow, and recover successful Virgin Island businesses. Again, the SBDC services are provided free of charge. You can make an appointment by calling 340-693-1694 on St. Thomas or St. John, and 340-692-4294 on St. Croix, or by visiting vispdc.org. Another technical service provider available to Virgin Islanders is called SCORE. SCORE offers business mentors, workshops, free business and financial planning templates, and guides to help you start or grow a successful business. The Virgin Islands SCORE chapter recently merged with the SCORE chapter in Fort Lauderdale, Florida, enabling it to provide highly qualified mentors with expertise in dozens of industries to help mentor Virgin Island businesses. To learn more or request a mentor session, visit score.org/USVI branch. If any Virgin Islander has a question regarding the program shared today, please do not hesitate to contact me directly at 340-473-7945 or wayne.huddleston@sba.gov. Thank you for including us in your press briefing today, and thank you.
Thank you, sir. Last week, Governor Bryan announced that he would, based on the progress of our public vaccination strategy, begin to ease some COVID-19 restrictions. The easement of these restrictions, which go into effect today, include restaurants now being able to seat 75% of their capacity. Those restaurants will also be allowed to seat more than 6 persons of the same party to a table, and taxis will be permitted to transport more than the current 50% or half its capacity restriction only, again, only if all the passengers are part of the same family or group. Beaches will be allowed 1 additional hour on weekends and holidays, now closing at 5 p.m. Please keep in mind social distancing requirements are still in effect. Masking requirements remain in effect. All other guidelines remain in effect. However, as we move forward with our vaccination strategy and toward herd immunity, Governor Bryan may consider easing some of those as well, in accordance with recommendations from the Centers for Disease Control and our local Department of Health. Since last spring, when Congress began considering additional pandemic relief legislation, Governor Bryan has been in communication with the leadership of both the House and Senate about the special needs of the territory to address not only the pandemic, but also the ongoing disaster recovery and rebuilding effort. The governor also ensured that President Biden and the White House staff were aware of the challenges confronting the territory in his initial meetings with them. In his most recent conversations with the senators and senior Senate staffers shaping the American Rescue Plan Act, Governor Bryan emphasized the importance of ensuring an equitable allocation of financial assistance and the need to address the ongoing loss of tourism revenues as we seek to rebuild. We are pleased to announce today that as a result of those lobbying efforts, the Senate version of the American Rescue Plan addresses the needs of the territory in the ways we had hoped, including preserving an equitable share of revenues and including upfront payments to reimburse our Treasury for making tax payments to our citizens. The American Rescue Plan has carved out support for Virgin Islands residents, including $1,400 direct stimulus payments to individuals and families, and added support for local and state municipalities, amongst other things. Speaking of stimulus payments, the Bureau of Internal Revenue and the Department of Finance continue to process stimulus payments and is currently processing for issue later this week an additional 7,000 units or approximately $4.3 million to Virgin Islands residents. To date, both the BIR and DOF have processed and issued 32,000 second-round stimulus payments, 26,000 of which were for regular income tax filers and 6,700 for Social Security recipients. As a reminder to the public, if you have not filed your income tax return for 2019, you have until Monday, March 15th to do so to be eligible for a stimulus payment. Keep in mind that this is for the direct stimulus payments under the $900 billion COVID relief package, or what we call the second stimulus, passed by Congress and signed by the former president in December of 2020. As an aside, the $1,400 direct stimulus payments included in the American Rescue Plan is also based on your 2019 income tax return and will be provided, and we will provide an update on the status of those payments once the legislation is signed and the funding is received. If you are not a tax filer, you can file a 2019 Form 1040 and annotate $1 on the interest line. Social Security recipients, if you have received your first payment, this second round will be mailed to you automatically, as the Bureau already has your information. Bureau has established a hotline to assist in responding to the volume of calls due to stimulus payments and refund check inquiries. That hotline number is 340-714-9325. Again, the hotline number for the Bureau of Internal Revenue is 340-714-9325, and you can utilize that number to inquire about the status of your refund check or stimulus payment. In closing this afternoon, on behalf of Governor Bryan, First Lady Yolanda Bryan, and the entire Bryan Roach administration, I want to wish you all a happy International Women's Day. International Women's Day is a global day celebrating the achievements of women and a call to action for accelerating gender parity. Here in our local community, women have contributed and have, quite frankly, led the way in many of our cultural, economic, and political advances. So today, I encourage you to celebrate those women and their achievements, and I am happy to have one of those women seated beside me, and that is Health Commissioner Hussein Kanasiong. Thank you for your great work and for leading the charge in our fight against this global pandemic.
Thank you so much.
You're welcome.
I actually have to say that when you said that, the first two people come to my mind is Delta Dorsch, as well as Yulili Rivera. There's so many more, my sister, of course, being one of those, but...
Responsible for the education of a lot of Virgin Islanders, so those two women are, yes, certainly celebrate their momentous achievements. We will take any questions from the media now if we have any. Caller, go ahead. Go ahead. Bear with us. We are trying to get that caller on the line. Caller, go ahead with your question. That caller is not, have some technical difficulties with that caller. Apologize for that. If you indeed have a question, please, we will be happy to answer that or reply to that via email or by some other means of communication. Thank you. That concludes our press briefing for this afternoon. Remember, we are in the public phase of our vaccination strategy, which means that any Virgin Islander age 16 or older can now get the vaccine. So please sign up for it. You can do that online, or you could do that via Vitima's hotline at 340-777-8227, or online by going to the Department of Health's website at COVID-19 USVI /vaccines. Thank you. Have a great afternoon.